This is Steve Carlson. It's the day before the primary. Well, I need to talk about health care as part of this primary election, even if it's on the day of the primary vote. First of all, they say only Democrats have ideas on health care. Anyone who doesn't support Obamacare, they say, is just against health care. Just selfish. I got news for the Democrats. My experience has taught me that those who take care of their own health care know a lot about health care. It's very popular, you know. It's not just a government program. Of course, most of us learn about it when we have a medical issue or someone we know has a medical issue, for instance, when we age. We get too soon old and too late smart, they say. But we all keep learning. Some of us should learn a lot more about healthcare problems we're making for ourselves. Drugs, alcohol, driving too fast, having irresponsible relations with each other, eating too much, not enough sleep, not enough exercise, sports. When you think about it, we're all always thinking about healthcare. What can we as a country do about healthcare? I have always said we are losing out to killer diseases. When these things hit you, it becomes a matter of survival. Life changes. Things that seemed ultimately important all of a sudden fade. So really the question is, how can we help each other? Can we all agree on that? Are there some health problems that in reality, if this guy you don't know, this woman you don't know, if they get hit by this, you will want to help them? Well, you should, because if it happens to you, you'll appreciate their compassion. I'm talking about killer diseases. I'm talking about saving lives, not just money. My work in the American Cancer Society taught me well that when you save lives from these killer diseases, you do save money. Because we all know by now, these things drive you into bankruptcy, into the emergency room. Now, is that all bad? I do not think that it is. Bankruptcy is for a fresh start. And if you get hit with these killer diseases, you or your family need a fresh start. We want you to go to the emergency room if you don't have coverage and you get one of these. Heart trouble, lung trouble, cancer, diabetes. And then there are these slowly debilitating diseases, multiple sclerosis, Alzheimer's. What I'm telling you is that as widespread as these perils are, insurance cannot handle them for all of the people who are at risk. This is what really drove us into Obamacare. And the real tragedy of what has happened with Obamacare has been hijacked by gender identity movements. The old wedge issues of abortion on demand and contraceptives for all, promiscuity. AIDS is waning in the background, where those who engage in same sex will want us to immunize them all with a special new expensive medicine that Government Cuomo, for instance, is just waiting to tee up. Well, it looks like he'll have to wait. I know we'll get dragged into the issues of what to do with Obamacare. You see, Obamacare is itself sick, and we need to think about how to save it. Forget about repealing it. It's a monstrosity. So we're back to the same old question. How do we save lives? How do we help each other? And how can we live healthier lives? When we feed immorality, we actually create more health problems. Do we want more young boys and young girls to be exposed to more and more homosexuality, more teen births, more sex-related social diseases? No, we can best help each other by not helping these things grow. Call it personal responsibility. Call it smart choices. Call it health education. If we can forget about this wrong-headed, actually destructive approach to health issues, we can focus on what I've been saying all along. And I'll put this issue up against Nancy Pelosi's, Betty McCollum's, Barack Obama's killer diseases, health disparities. Some people, because of their situation in life, are at greater risk for these killer diseases. People with poor diet because of poverty or stress, overwork, are at greater risk for heart disease. If they smoke, lung disease and heart disease. Addiction, cancer, diabetes. This greater risk, when associated with a class of people like a race, a culture, or income level, is called a health disparity. Can we forget about ruining health insurance and ruining the economy with Obamacare? I'm afraid we cannot forget about it until we focus on what we need to do. something that needs all of us. The National Breast and Cervical Cancer Early Detection and Treatment Program. In Minnesota, it's supported by SAGE and by medical assistants. States can use their Medicaid dollars to support this kind of program. It saved lives in my own family. I was campaigning saying this program is the model we need to adapt to each one of these diseases, and cancer struck. And this program, already in place and up and functioning, unlike Obamacare, was there, and it saved a life, and I am grateful. I'm also aware that I was right. This is what is needed. I've seen it in action, up close and personal, and I want it to be there for you. What we need are successful outcomes in areas where great compassion is needed. I have had the good fortune to help people at the airport in wheelchairs. It's a job I enjoy. Helping people is good for the soul, and that's what we need to do. I meet rich people, poor people, people from all walks of life, the military. Work like that and efforts like I'm talking about don't divide people, they bring people together. If we can stop using healthcare as a tool to divide, to attack people's religious liberties, we can organize America to save lives, across party lines, public sector and private sector. It's love conquering hate, life conquering death and suffering. And so I won't support Obamacare. It's robbing the young and healthy to pay off costs of the older and less healthy. That's not insurance. And to do it, it's hurting the job growth for the young people even while they're being taxed more. So when you talk with me about healthcare, let's talk about saving lives, working together to save lives. Emergency room, universal access like Ronald Reagan created, that's good. It's not good to be in the emergency room. It's good the emergency room is there for you. We just need more doctors, and a lot more doctors. And we need people to keep learning about their health and take it seriously. Bankruptcy? Well, if it's for a medical reason, it's hard. But it means a fresh start. It's something you need. We need something that will unite the private donors with the medical community, the private contributors, and effective local emergency and medical resources. We need best practices. So we need to repeal Obamacare, but we need to get into healthcare in a big way. We need to target health disparities and killer diseases. The goal is not to replace Obamacare. The goal is to make progress toward ending health disparities. So what's the game plan for that? It's stop making people the target of the IRS, more oppressive government waste and intimidation. Start making people the target of love and compassion. Unite the people. Don't divide the people. Don't tell people you're on the wrong side of history. We need you to die off because you're stopping progress. Let's get back to saving life and drop the political shtick. I'm Steve Carlson. I've got a heart for saving lives, and if you elect me, I'm not going to Washington to kill off Obamacare. It's already finished. I am going to work through government to create coalitions with free Americans to effectively target killer diseases and health disparities. And I approve this message.